This is a demonstration of a static quads exercise. Sitting in a comfortable position, a little bit of support under the knee. You're going to pull your toes up, brace the knee back, feel the muscles in the thigh, go firm and slowly relax. Pull the toes up, brace the knee back, feel those muscles go firm and slowly lower and relax. That's your static quad. We're now going to progress to inner range quads. So you're going to put a ball under the knee, start position with the knee a little bit more bent, pull your toes up, brace the knee back, feel those muscles in the thigh, go firm and slowly lower. Pull the toes up, brace the knee back and slowly lower. We'll do it once more time. Pull the toes up, brace the knee back and slowly lower. We're going to get rid of the ball now. And just with a straight leg, we're moving on to leg chops and straight leg lifts. So the toes are pulled up, the knees braced back, and you're going to lift the leg, straight leg lift, and slowly lower. Pull the toes up, brace the knee back, lift the leg, and slowly lower. We can progress that by performing leg chops, where you pull the toes up, brace the knee back, lift the leg and short little chops and lower. If we want to work the vastus medialis oblique, which is on the inside of the knee, we're going to do the same exercise. Toes are pulled up, knees braced back, toes are tilted outwards and the leg lifts. And slowly lower. And again, this can be done as a chop. Pull the toes up, brace the knee back, tilt the toes out and chop. And relax down. This is a bridging exercise, a glute bridge. The start position, you're thinking about your hips, your knees, your ankles nicely lined up. Knees bent, feet flat. Inhale, exhale, tilt the pelvis to imprint your lower back against the floor and then slowly peel your back away to lift up into a bridge. At the top of that bridge, have a feel of your glutes. Your bum muscles should be nice and firm. Breathe in at the top, breathe out and slowly lower one vertebra at a time all the way back down to your start position. Now if you feel any twinges through the hamstrings, at the backs of the thighs, just bring your heels a little bit closer to your bum. Check that your hips, your knees and your ankles are nicely lined up. Breathe in position. Breathe out, tilt the pelvis to imprint the lower back and peel your back away on that out breath to lift up into a glute bridge. Have a feel of the glutes at the top. Breathe in position. Breathe out and lower one vertebra at a time, nicely controlled, all the way back to your start position. This is an exercise to work your gluteus medius. You're lying on your side, your knees are bent to around about 90 degrees and your hips bent to about 45 degrees and your spine is in neutral. So take a moment to breathe in. As you breathe out, go to flatten your back, draw your belly button gently in towards your spine and drop the ribs towards the pelvis. You're going to place your fingers on the muscle which is at the top of the glute and that's where you should be able to feel the contraction. Keep your feet together and lift the top knee slowly with moderate effort. You should only feel that gluteus medius working. You're going to repeat this, lower and lift. Make sure that you don't roll backwards. It's important that you keep the hips stacked one on top of the other. No backwards rolling. Repeat the lift and lower. If you feel any other areas kick in and start to burn through the calf, the leg underneath, the front of the thigh, you stop, reset, start again. This is a knee bend exercise. We're going to start in standing. Think about starting with good standing posture, feet in neutral position, nice soft knees, glutes working around about 50%. You're going to engage your gluteus medius by tearing the paper. Imagine that you stood on a sheet of newspaper and you're going to put pressure on the outside borders of your feet to try and tear this imaginary newspaper down the centre. If you were on ice, your feet would scoot out to the side. So you're going to add that little bit of pressure through the glute medius by tearing the paper around about 50%. Drop your ribs. Gently draw the belly button in towards your spine. Elevate up through the pelvic floor. You're going to bend your knees with your arms coming out forwards as if you're going to sit down on the chair. Drawn up through your belly button towards the spine, squeeze through your glutes to come back up into standing. Take a moment to check on your standing posture and then slowly bend those knees as if you're looking to sit down on the chair. Draw up through your glutes, pelvic floor, belly button drawn in towards your spine, back up into standing. You're going to go for one more. Tearing the paper throughout the movement. This is a wall squat exercise with a stability ball. You're going to lean against the wall, against the stability ball. Think about your feet being around about shoulder width apart, hips, knees, ankles nicely lined up. We're just going to start by engaging the core. A breath in. As you breathe out, drop the ribs, gently drawing the belly button in towards the spine. Elevate up through the pelvic floor. And then hold that position. Breathe in again. And as you breathe out, you're going to drop into a squat. Arms coming up and forward. Use the support of the ball. Pause at the bottom of the squat. Breathe in. Breathe out. And back up to your standing position. Take a moment to check in on your posture, engaging the core and lowering into the squat. We're going to hold at the bottom, some little pulses at the bottom of the squat and then back up to the start position. You can vary the pace, so you can do a quicker down into the squat and a slow up. Quick down, slow up. And you can do a slow down and quick up. Slow down and quick up. Here we're going to work on some knee dips. The last few degrees of extension of the knee, working on stability of the knee and developing the vastus medialis oblique. You can do this on your bottom stair at home or using a step. Here we've got a step and we're using the back of the chair as the banister. So you're going to step up onto the first step, both feet. Take a moment to check in on your posture. Make sure that you breathe in. Breathe out, drop the ribs, draw the belly button gently in towards the spine, elevating up through the pelvic floor and feel those glute muscles working for you. Then you're going to transfer your weight over onto the one knee, 1 foot, using the support at the back of the chair or the banister, and then you're going to dip by bending that knee and back up to the start position. And you repeat this. When you're repeating these knee dips, you're thinking about the knee staying nicely aligned with the knee travelling over the toes. You do not want this knee to wobble inwards. Staying strong through the core, keeping these dips controlled and working through that movement. We can repeat this if you can turn around. So you turn it to face the other way. We're going to do a dip downwards off the step. A little bit harder to control. Use the support of your banister or the back of a dining chair if you do have a step. Working again on keeping the knee nicely aligned, travelling over the toes, and a strong controlled dip. You can also work this dropping off the side of the stair, so if you face the back of the chair, I'm going to drop one foot off the edge of the step into a knee dip, making sure that that knee stays nicely aligned, not wobbling inwards, knee travelling over the toes. You can do some knee dips without the stairs or without a step. Have something handy to give yourself a little bit of support. You're going to take a moment to check in on your posture, deep breath in. As you breathe out, the ribs drop, gently drawn in towards the belly button, towards the spine. Feel the glutes on around about 40 to 50%. Use the support if you need, and you're going to weight bear on one leg. And you're going to do these knee dips, small movements, dip, back up, all the time checking that the knee is nicely aligned over the toes, it's not wobbling inwards. You can repeat these with the leg, the non-weight bearing leg forwards. And you can also alternate between the two with the non-weight bearing leg forwards and back and forwards and back. So the alternating to make it a little bit more challenging. All the time checking that the knee is nicely aligned over the toes and a good strong knee dip. This is a door slide dip. You stand inside onto a wall or a door that you can slide on and then just lean against it with that shoulder. You're going to weight bear on the foot that's furthest away from the wall. Pushing against the wall, you're going to dip that weight bearing knee and slowly straighten up. Dip and slowly straighten. This is a good exercise to work the vastus medialis oblique, and you should feel that muscle go firm as you're pushing your shoulder against the wall, and nice controlled dips with the knee travelling over the toes, staying nicely aligned. This is a lunge exercise. We start by checking the posture and engaging those core muscles. Take a breath in. As you breathe out, drop those ribs, gently drawing the belly button in towards the spine, elevate up through the pelvic floor. Have a feel of the glutes on around about 50% before we start. You're going to weight bear on one leg and take the non-weight bearing back into a lunge and drop as far as you can go comfortably, and then back up to the start position. So that right leg is going up and back to the start position. You can repeat that. You'll notice we've got a chair just for a little bit of control and to assist balance. And while you repeat this lunge, you're making sure that the front knee is bent nice and strong, not wobbling inwards, staying aligned. Then we can go into a forward lunge. Again, the weight bearing leg in this case is the left leg. Back up to the start position. Dropping into a forward lunge. Again, we've got the support of the chair if needed. And you can, for a challenge, alternate between a forwards and backwards lunge. Slow and controlled, making sure the knee stays aligned, keeping the core muscles engaged, not allowing the weight bearing knee to wobble in, and that front knee to wobble in. Everything's strong.
Okay, we're going to do some balance work by just standing on one leg, And it's worth counting how long you can balance on one leg so you can measure the improvements. And then to make this more difficult, we're going to change the foot position, so putting the leg out in front, change the centre of balance, and then out to the back, good balance, and then back to the middle, and then go out to the side, and then back to standing. And we can progress the balance work by standing on a cushion. And again, you can count how long you can balance. And if that's easy, you can put your leg out in front again. Bring the leg to behind. Bring it back to the centre and then go out to the side. And relax. Progressing on to functional strength and balance, we're going to introduce the hop. Single leg hop, just in the same place. Control and relax. We're going to progress the hopping to a hop and hold. Control and repeat and hold. That's good control. Progress the hopping from side to side. Progress the hop to a skater hop, side to side, with control.
And this is a nice quadriceps stretch. Standing tall, pushing the hips forward, pointing the knee down towards the floor, and you should feel a good stretch through the front of the thigh. You can also release that foot onto a chair and maybe a hop forward with the weight bearing leg. Drop the weight bearing leg into flexion and feel the stretch coming through the hip flexor and the thigh, pushing the hips forward. You should feel a nice stretch through that thigh. Here's a hip flexor stretch, so the front of the left thigh here is being stretched. You need to be pointing the hips forwards and sink into that stretch. Use your breath, using the support of a chair if need be. Opening up the front of the hip, and if comfortable, you can lift the stretched knee away from the support and open up that hip flexor. Feel the stretch and breathe. To add a little bit more, you can lift that same arm, in this case the left arm, up towards the ceiling. Open up the stretch, and if needs be, drop that knee back down. Feel the front of that left thigh open into your stretch.